Hello everybody, welcome to UroChannel. So far I did 2 videos about trauma care for everybody to assist those civilians injured in the war in the Ukraine. I will donate all revenue from this video series to the Ukraine Humanitarian Fund of the UN. In order to get the information to where it is needed, I need your help. Please share this video to someone you know in the Ukraine or to someone whom you think knows somebody there. Thank you. In the last video, I started to explain the principles behind ATLS, which is the Advanced Trauma Life Support Program. In case of an emergency, you will have to follow a very specific protocol in an alphabetical order, which is A, B, C, D, E. After airways and breathing, circulation is next. In other words, problems with bleeding. Bleeding means loss of fluid, and this is the most important cause of death after an injury. How do you assess the patient's hemodynamic status? Look for 3 things: level of consciousness, skin color, and pulse. When a critical amount of blood is lost, blood flow through the brain will be decreased, meaning that consciousness suffers. A wounded who talks to you in a normal way will still have sufficient blood flow in his brain. Look at the skin, especially at the face and arms and legs. If they are pink, there is most probably no immediate danger. Assess the pulse of the patient at the neck, where it is easily palpable. A rapid, thready pulse is a sign of hypovolemia, which means blood loss in this case. This first assessment takes no more than a few seconds. The next thing you want to do is look for and control any external bleeding. Mostly it will be easy to spot, but it is always wise to examine the whole body from all sides. You might miss significant findings otherwise. Like, for example, gunshot wounds. The bullet enters the body in one location and ricochets off to any location in the body. It may even leave the body in a place you never would expect. If you find an external bleeding, you stop it by applying pressure. In the movies, you often see tourniquets wrapped around the limbs. This should only be done in exceptional circumstances, like an amputation of an extremity. Tourniquets are problematic because they crush tissues and interfere with the blood supply of the healthy tissue underneath the injury, which then gets damaged as well. Blood may also be lost internally. Long bone fractures and fractures of the pelvis go along with a substantial, life-threatening blood loss. This means that after looking for external bleeding, you will have to search for these hidden sources of hemorrhage. Bone fractures of the thigh or the shin are quite easily diagnosed. Pelvic fractures can be more difficult. Gently apply some pressure onto the pelvic bones to test whether stability is still present and if it causes any pain. If you diagnose fractures of this kind, you will have to stabilize them. For the pelvis, you can use a bed sheet. Wrap it around the pelvic area and tighten it to compress the fracture and stop the bleeding. In bone fracture, you will need to stabilize it so the ends of the fracture can't move around. Look for any open wounds and cover them with sterile bandages. Then there is need for fluid supplementation. Most likely, you will neither have the equipment nor the training to establish a venous access. Drinking is the next best thing. Mix 1 liter of water with 8 teaspoons of sugar, add half a teaspoon of salt and half a teaspoon of baking soda. That makes a slightly hypertonic solution that will replace the loss of fluid and salt. Pain is an issue too. You might have painkillers at home. Ibuprofen would work, for example. Stay away from aspirin, also known as acetylsalicylic acid, because it may prolong bleeding. If you have morphine at home because there is someone in the household with severe pain, like from cancer, be careful. Use little doses to begin with. Patients taking the medication on a regular basis are used to it and tolerate much higher doses. Thanks for watching. Take care. Bye-bye.